Hi, Dave with Align Therapy here. I'm here with Sammy. Sammy's going to help demonstrate some strengthening exercises that we usually do with scoliosis. The reason I brought Sammy in to do this is Sammy can hold a plank forever. She is second highest on our plank wall of fame, which we have back here in the clinic, and she held a plank for 11 minutes one day in treatment. So I had to stop her from doing that during treatment because she was wasting all of our time because she's such a pro at planks. So planking is something that we're going to show, but let's do the top 3 exercises to strengthen different areas of the body when you have scoliosis. So these, first of all, these are not corrective exercises. These don't change the curve. We're not stopping progression with these curves. We're not with these exercises. We aren't trying to reduce the curve with these exercises. These are exercises that we just want some baseline strength in the core and some specific muscles in the body. So let's start with just a regular plank. So Sammy, go ahead and show us a plank here. Perfect. So she can hold this forever, so I can just keep talking. Come on over here. Let's look at Sammy's back here while she does this plank. So one thing, Sammy is a dancer, and so she has really good body control. She has good body control with keeping her pelvis in a good place. But right here, as she starts to get tired, oh, thanks for showing me that. As she starts to get tired, her shoulder blades start to come up a little bit. Show me that again. So we start to lose that stability. So we really want that stability in the shoulder blades. So push up here a little bit again. Good. So Sammy has a curve that goes right here. So you can see this right side's a little higher than the left side. You getting tired yet?
Not really.
Not really. She could go forever. So we see that scoliosis curve here. We see this is a little bit taller, a little bit higher on this side. And as she forgets about it, we start to sag here again. So we keep having, bring that back up. There we go. The second thing to watch for is the pelvis. I don't want her pelvis to be rotated one way or the other. I want it to be straight so that it's flat. Her low back shouldn't be arched too much. Can you show me what that would look like? Other way, down. Like, whoa, we see that go too. But we don't want all of that to drop down here and here. We want to keep a nice straight plank. I wonder how long I could talk and how long she could maintain this. So that's a plank. Make sure good form, good stability. Fantastic. Okay, you good? All right, go down. So the second exercise that we're going to do is a side plank. So side planks are one of my favorite exercises for scoliosis. They are good for strengthening those side muscles that tend to get weak with scoliosis, and that's the direction that the curve is going. So we want to strengthen those muscles so we can use them for correction. So a couple of things form-wise with this. Sammy does a fantastic side plank. We're trying to keep those shoulders stacked right on top of each other. Legs out straight if you can do it. If you can't do that, then just bending the knees and going up at the knees. Can you show us that one? Yeah, like that. Good. A little bit easier, a little less of a load on the back and the spine and the muscles. So go back to the one on your feet. If this feels like you're going to fall over, you can stagger your feet. So bring one foot in front like that so that you're a little more stable. But if we can get to where, go and bring your feet back on top of each other, where you're nice and stable like that, that is perfect. Great. Looks great, Sammy. So go ahead and turn to the other side, Sammy. And I want to show one thing that we look at, other than being in a good line here. If you come a little closer, if we watch that shoulder blade on the bottom, bring that up a little bit. See if you can push, you've been doing it for a little bit, see if you can push up with the shoulder. It's a weird position. So that your shoulder blade doesn't come to the middle. See if you can push your shoulder out. Ooh, a little more. A little more. That's kind of tough. Kind of tough for Sammy there. But trying to keep that shoulder blade as stable as we can get it is really helpful. So that we're not just hanging on the shoulder like that. Through the core, Sammy's really strong. But that shoulder blade, we could probably work on that just a little bit. So that's great. Go ahead and go down. Over the third exercise. The third exercise, come on over here, Sammy. The third exercise, we're going to use these bands. This is one that sometimes I like rowing for scoliosis and sometimes I don't. I'll show you why. So a row is just pulling back and pulling the shoulder blades together. So Sammy, go ahead and do that for us. Good. Pulling back. Excellent. Bring the elbows back a little bit further, keeping nice and stable core. The resistance on this band is about as much as Sammy weighs, so she has to kind of keep some stability there. But what I'm watching for is her shoulder blades. I want her shoulder blades to come back and activate these muscles right between the shoulder blades. So that looks really good. And Sammy has really good body control, so we don't have to worry as much about compensation. But the main compensation I see with this exercise, I want you to pull back and just slam those. Yes, there's the compensation that we see. You already knew what I was going to have you do. So extending the spine too much. I want the shoulder blades to get stronger, but I don't want to arch the back. The reason is, with scoliosis, we already have, we usually have a loss of the normal curve of the back looking from the side. So if she's rowing, keep going a little bit, and we're doing this, then we're extending the whole spine. We're losing even more of that curve. So if we keep this nice and tight here, and go ahead and pull back, squeeze the shoulder blades. Good, perfect. So we see those muscles activating, but we're not seeing extension of the spine. So that's what we look for with rowing. If you're doing it correctly, we shouldn't see movement here. We should just see the shoulder blades moving. The reason we work with this, remember on Sammy's back, this side is back further than this side, which makes her right shoulder sit forward a little bit more. That can create some pain and dysfunction on the right side of the shoulder, on the right shoulder. If we can get those muscles to strengthen and stabilize back, that pain usually goes down, and it also helps the shoulder to function better. We don't want to just slam everything back though, because then it compensates with other things. So rowing's a good exercise, just shoulder blades coming back and together, no arching there. That is perfect. Very good. Okay, you can drop that. So those are 3 exercises that are great for strengthening if you have scoliosis. These should be good for anyone to do, but if you're having pain with these, back off and consult with a licensed physical therapist and see if it's right for you. If you have questions on scoliosis specific exercise, we would love to chat with you about it, so you can contact us or check out our website. And hopefully this video was helpful. Thank you, Sammy, for helping us out, and have a good one.